I swear, every time I think I'm going to take a long break or even quit making videos for this channel, a subject comes up that I believe I must make content about to express my thoughts on said issue, and boy, this certain issue is a doozy. Me making a video on the American healthcare system was merely an inevitability, and I never had just one certain opinion about our system either. For most of life, up until a few years ago, I was extremely naive and ignorant on the issue. I didn't really know much about it or how the system worked. Now it is much more clear to me and very fucked up. If anything, COVID-19 showed us how fucked up it is because now millions of people have lost their healthcare as a result of the pandemic because we idiotically have healthcare tied to employment in this country. For most people that is, not all. Now, I don't really want to just go over the problems because there are plenty of other YouTubers and experts out there you can listen to for more information about that. I want to talk about what we can do and what we need to do for reformation of this piss-poor, embarrassing, ass-backwards system. Now, the first goal should be a universal system, one that guarantees healthcare to all people for free or at a very low-cost copay. It isn't fair, moral, or even smart to have a healthcare model that leaves millions uninsured, especially in the time of a pandemic with a virus that is contagious. And regardless of coronavirus, there is no good reason for people with healthcare needs who are unable to afford to go to the doctor or are scared to because they don't want to rack up thousands of dollars in medical bills. Some propose Medicare for all, which I am mostly on board with. The overall proposed cost for that model does concern me, but it's been proven to be cheaper than what we have now and more efficient. And there are some misconceptions, very dumb and misinformed ones, about Medicare for all that need to be struck down immediately each time they are brought up. One is that it is fully socialized medicine. It's not. It's publicly funded insurance, as in that Medicare tax that comes out of your paycheck that goes towards the general fund. The service, as in the hospitals, ERs, and urgent cares, are mostly privatized as they were before, unless they were a, government-formed and operated establishment, but those are few and far between. That also dismisses the it'll be just like the VA argument, because the VA is fully socialized healthcare with government-run hospitals and clinics and government-funded. Ralph Nader summed it up perfectly in 4 words: government insurance, private delivery. That's what single-payer means. It is also a good system because it means that even if you lose your job, you still get the same healthcare as anyone else. I also like a shared universal system because it will be the same system the rich will have to use, so they'll be inclined to ensure it is working and funded properly because their healthcare depends on it too. It doesn't have to be Medicare for all or the exact system Bernie proposes to the T. There are many other healthcare systems around the world we can use as a model to create our new system. France is often considered to have one of the best systems in the world, like top 3 every year. They cover everyone, but allow people to buy supplemental insurance and have other differences than what Bernie's plan proposed. The UK has the NHS, which covers everyone, but it is more of a fully socialized system like our VA, except it's 100 times better because it's properly funded and supported by all UK citizens. There's also Canada that has a multi-payer system where each province has its own single payer, but it's still universal and covers every single Canadian citizen. There are also more privatized systems like Switzerland and Singapore that still manage to cover all their citizens. My point is, all these other countries have different systems that still manage to make it universal, and each one still blows ours out of the water. The American healthcare system is a joke around the world. If you want to learn more about those systems I mentioned and more, I'll link videos in the description. Many people, and one that comes to mind is Martin Luther King Jr., said something along the lines of, and I'm paraphrasing, "It's evil that there is inequality in healthcare." So one must ask themselves if a rich person's life is more important than a poor person's life. Sure, most non-sociopathic people will say everybody's life is equal and worth saving, but our system does not reflect that. Rich people get the best healthcare, the best insurance plans, and get to skip to the front of the line, while the poor and working class gets none of those things. There's also this capitalist libertarian notion that proposes the solution of having a completely free market in healthcare. In my opinion, that is a goddamn terrible idea. Now, is there some red tape and stupid regulations that we should cut out to make the system better if and when it is changed, and even now? Yes. But in terms of having the government completely out of the system, I do not agree at all. 1. Private insurance companies get money and profit by denying care. That's how it works, and that will not change if the free market is left to reign. Plus, in regards to this current pandemic, if people lose their jobs and hypothetically they don't get another source of income over the next year or so, how are they going to pay their insurance premiums? Most of them won't and will be super fucked. A lot of libertarians like Charlie Kirk bring up this LASIK eye surgery example of how the free market brought down the cost of that particular elective procedure. In a debate with Sam Seder, he brought up how it used to cost like $2,000 per eye. Now it's $500 per eye or something like that. Okay, well, there have been recent polls and studies that prove that nearly 75% of Americans can't afford a $400 emergency. And that was before this pandemic. $1,000 is still a lot of money to the vast majority of people on this earth. So that's not the best example that will win over most normal, sensible people. A better system than a free market system would be one that is not meant for profit, so that the vast majority of the money it pools would be used to pay for people's care, not to give out as bonuses and stocks to wealthy owners and board members or to pay for advertisements and lobbying. The profit motive shouldn't exist in relation to people's health and suffering. Now, I want to try my own little thought experiment here and take a swing at what I would do to reform this clusterfuck of a system. First, which country do I think would be a good model for the foundation? In my opinion, probably something close to what France has. Again, I am just trying to find examples to form a solid foundation, not copy and paste. In France, their universal system is called Social Security, and it covers up to 80% of French people's healthcare needs, or at least it used to. I'm not sure if things changed and it covers more or less. The French often make slight changes to their system every once in a while, so yeah. But the point is that their universal system covers the majority of your healthcare cost. Now, some people don't think that's enough and that it should be no less than 100%. I'm not completely sold on that yet because, one, we need to keep costs down when and where possible, and if you have a system that requires people to help pay for their own care, even if it's just 10 to 20% of the cost, then you incentivize a culture of healthier living and more consciousness when people go out to seek care. To cover the rest of their care, French people can buy supplemental insurance to cover the remaining cost of their medical care, and those insurance companies are regulated to be private nonprofits and that they cannot deny paying for your care so people don't get screwed over, essentially. And if I'm not mistaken, this is a similar system to what Japan has. From the very little research I did, the Japanese system covers anywhere from 70 to 80% of cost, and the citizen is responsible for the remainder. If you know more or need to correct me on that, please comment below with possibly a link to a video I can watch or an article I can read. I wish the Healthcare Triage channel would make a video about the Japanese healthcare system. It'd be very interesting. To sum this up, I'm for a system that covers at least 80% of your medical care. I'd even argue upwards of 85 to 90%. From there, I'm okay with there being insurance companies to provide supplemental care for regular healthcare and elective procedures if those companies are regulated to be nonprofits and required to pay for the majority of your remaining costs. For example, you have a heart attack and wake up in the hospital. Then after treatment and leaving the hospital, let's say the total cost of everything was $50,000. Since we have a Medicare system already in place now, we could just extend the coverage to everyone with an increase in taxes. So Medicare would pay for 80% of your care, which would be $40,000. Now that leaves you with $10,000 left to pay off. Well, if you have supplemental insurance, you could end up paying anywhere from 1 to 10% of that bill, roughly. And what you yourself would pay out of pocket for this whole ordeal would be anywhere from $100 to $1,000. And that all depends on the insurance plan. Now, that $1,000 cost, if it did turn out to be that, would be very difficult for most people to pay off. But in this new system, you don't have deductibles or other things leeching money out of you, so it makes it easier to pay off. And you can set up a payment plan to eventually pay it all off if you can't in one lump sum. I have no illusion that any universal system we implement will come with out-of-pocket expenses and co-pays. And I'm not 100% against those because, again, it causes people to be more conscious of their lifestyle. Now that's just a very basic rough draft proposal of my system. The awesome thing about other countries and their systems is through regulation they control how much hospitals can charge for a room and overnight stay. So in the event of that proposed heart attack scenario, the largest bulk of that price will come from hospital room costs. And a regulated system will ensure hospitals can't price gouge and lower the cost of those rooms. So now that total cost could go from $50,000 to maybe $40,000 or $30,000. Again, this is just a rough draft plan. I'm okay with co-pays and some out-of-pocket expenses as long as they are reasonable and regulated to not be cripplingly expensive to the individual or family. Other countries have figured this all out, and we need to listen and learn from them. And, of course, I shouldn't forget to leave out the bullshit costs of prescription drugs. The United States is the only developed first world nation that does not regulate and negotiate drug prices for its citizens. In America, a vial of insulin can cost over $300, and in Canada it's like $30, and in Spain it's like €6 or something. Life-saving and pain-relieving medicine is super cheap in other smarter countries, while over here the poor and sick are left to suffer or go into financial destitution. Really think about that shit. What we have now cannot last and is unsustainable. It's far too expensive, wasteful, and immoral. 500,000 people file for bankruptcy each year due to medical bills, and upwards of 40,000 people die each year due to lack of healthcare for being uninsured or underinsured. So, I am glad more and more people are starting to revolt against it. Hopefully, this will lead to more positive changes in the future. Granted, I know with either Biden or Trump in office, those changes will still be prolonged and barely existent, but maybe with Biden in office, we can create pressure from below to force change, like possibly lowering the Medicare age from 65 to 55, like Bernie proposed. We'll see. For this video, I do want to get a conversation going. What are your thoughts about the American healthcare system? What do you think about what I just discussed? Do you agree or disagree? Or do I have a couple facts wrong here or there? Please comment below because this is a very important topic that requires a lot of discussion and debate.